And the first one that we always tend to see with runners, tight hamstrings, doing a lot of things to the hamstrings to strain them, to make them painful. A lot of runners have tight hamstrings. The flexibility issues come into play. A tight hamstring can happen from many different reasons. Could be a shift in your pelvis, could be low back pain. Most of the time it's from inflexibility from not stretching. And tell me a little bit about what you see in the clinic, your place.
What I see, and when we do our evaluation, and I can tell right away when I have a runner on my hands, a distance runner, because the strides are very short and they're usually not their proper gait. So they're not really getting the full extension, which is causing, like, imagine if I did curls like this constantly for about an hour. All right? So that's what you're doing when you're running on a stride that's too short. And so all of a sudden you're strengthening a tiny part of the muscle, and then all of a sudden things are pulling in the wrong places, and your hip flexors are tight, your hamstrings are tight, your glutes don't seem to fire. And it's because you've been working in that limited range of motion for so long, repetitively. So one of the first things I like to work are some range of motion ideas, and we're going to talk about some things that's going to help you to get that range of motion.
Definitely. Reggie, hitting on some of those big points, limited range of motion, in firing those muscles of the hamstrings in a certain range where it inhibits other motion of other muscles that need to work. So that flexibility component's big. The hamstrings, tight hip flexors, Reggie mentioned, and that will decrease your range of motion of the joint. The joint has a certain mobility range. It'll decrease that. That leads to injury because now you're forcing things, energy, into places that only have a limited range of motion, and that ends up giving you problems.
That's big. So having the flexibility is gigantic. Lack of strength. We talked about, okay, if you're working your hamstrings repetitively over and over and over, you're going to have some pretty darn strong hamstrings. But what about the rest of the muscles? We're a big chain. We're not just certain muscle groups that work together. It works as a chain. If you have weak hamstrings, if you have weak hip flexors, any number along the chain, you can get injured when you go to make a movement that involves the strength of those other muscle groups. I always harp about the pelvis being weak in runners, the abdominal region being very weak in runners. Runners typically tend to have really strong hamstrings, really strong calves. Why? Because they're constantly going forward, constantly moving forward. But the other parts of the body are vital. They have to be strong. You make lots of lateral movements. You make turns. You even do some backwards walking sometimes. These muscles have to be strong, once again, or some muscles will try and take over, and it'll cause strains, sprains, and that kind of stuff. So tell me a little bit about, Reggie, tell me a little bit about what you see when they come in and you're trying to train these folks and what they want to do and what they should be doing.
Right. A lot of what I see is, like, to Mike's point with the straight line movement, struggles with lateral movement, okay, and change in direction, because most of the change in direction occurs first in the core. Okay, you have to stabilize with the core first before you change direction. So it starts to become a little troublesome in catching your balance if you're not used to changing directions and you haven't strengthened the muscles properly in order to change directions. So that's what you have, is a lot of times I see people that are doing even lunges, which is still a straight line movement, but there's balance involved, there's core engagement involved. It's a range of motion type movement. So I see that almost immediately with a lot of runners. And definitely with the change in direction and the lateral movement, it's usually slower. It's much slower than it should be.
Right.
So that's something that we immediately work on, is making sure that you're being athletic. Not just being a runner, just being athletic and being able to do whatever is required of your body to do. Your body doesn't move in space in just one direction forward. So it's important that we make sure that you're able to do multiple things with your body.